Hello, welcome to Physionic, where we learn the body from the macro to the micro. In this content, we'll be diving into a study investigating the effect different versions of vitamin C, or ascorbic acid, have on acne, more specifically acne-related bacteria.
Learn your body, a science-based education.
The data comes from a study that I will have linked for you, as well as my notes and any amendments that may follow. Before getting into the background, I would like to point out that some of the researchers were working for an independent research lab, while the rest were from a university, and as is usual, the study was peer-reviewed by independent researchers. To begin, let's briefly characterize what acne is. Acne is an infection of the skin that can be caused by a series of different factors, but in this study the focus is on a common bacteria known as Propionibacterium acneus, or known more easily as P. acne. Acne bacteria infiltrate the sebaceous gland of the skin due to overactivity of the gland in producing the oily substance known as sebum to lubricate the skin. The invasion of this bacterium leads to the overproduction of reactive oxygen species, or damaging oxygen molecules that damage the cells around the area, causing premature skin cell death. This accumulation of dead skin cells, bacteria, sebum, and other factors, and the eventual invasion of inflammatory cells to cope with the problems lead to visible raising of the skin. Acne hath been born. Unfortunately, while there are several drugs that help kill these bacteria, alleviating a large component, there are more and more drug-resistant bacteria, and P. acne is no exception. So, does a vitamin C help inhibit this bacterium? The data shows the comparison of zinc ascorbate, or vitamin C chemically bonded to zinc, against 5 different drugs in isolation, and then again in combination with each drug. The researchers were looking at the minimum inhibitory concentration, or the point at which the bacteria began to have significant inhibition of growth. So the lower the concentration needed of each agent, ascorbate or drug, the more potent the agent. Paired with 3 of the 5 drugs, zinc ascorbate reduces the necessary amount of drug to elicit the same result, reduced bacterial growth. This implies that zinc ascorbate has an additive effect with some drugs, but not all drugs, as 2 of the drugs did not experience a benefit. This pans out exactly the same when looking at 90% inhibition of bacteria, a further sign of zinc ascorbate effectiveness. This then raises the question if zinc ascorbate can also be effective against drug-resistant bacteria. Admittedly, I'm not a fan of how they presented this data, because it would have been more impactful to have the dose-response curve instead of just saying it took something above this maximal number, but I digress. The research shows that maximal drug concentrations are needed to inhibit drug-resistant bacteria, if they inhibit them at all. However, in combination with zinc ascorbate, although the drugs seem near useless, the zinc ascorbate has an effect inhibiting bacteria. So, in conclusion, this study data shows evidence that zinc ascorbate, zinc and vitamin C bonded together, is effective at inhibiting acne-associated bacterial growth in isolation, but also as an additive to conventional acne drugs. It is speculated that zinc plays a role by inhibiting enzymes in bacterial glycolysis by damaging them. Otherwise stated, zinc damages proteins within the bacteria responsible for bacteria's metabolism, essentially starving them to death, while vitamin C acts as an antioxidant, reducing the damage surrounding skin cells occurring by reactive oxygen species discussed before, and likely acts on bacteria directly as well. With that said, I hope this proved informative, and I hope to have the absolute pleasure of speaking with you in the near future. Bye.